welcome our speaker, Dr. Sanjay Zodpey, the Vice President for Academics in Public Health Foundation India, New Delhi, and Director of Indian Institute of Public Health, Delhi. I request sir to grace the dais. Dr. Zodpey's background as a physician, epidemiologist, scientist, and a thought leader on public health uniquely positioned him to drive the global public health agenda. Professor Zodpey completed his medical education, MBBS, MD, and PhD from Government Medical College, Nagpur, India. He has also acquired postgraduate qualifications in sociology, public administration, and economics from Nagpur University. His current professional interests include global health, health system research, maternal and child health, vaccines health workforce development, and education of health professionals. Recently, Sir has been elected as the president of prestigious Indian Association of Preventive and Social Medicine. I request Dr. Sanjay Zodpey, sir, to kindly share his knowledge on this topic.
Thank you, and a very good morning to all of you. Dr. Rajiv Ayurvedekar, academic leadership of Symbiosis International University, distinguished faculty, students of various programs, invited guest speakers, and ladies and gentlemen. It is indeed to be part of this gathering and sharing with you some thoughts in the context of shaping the slogan for public health agenda, particularly looking at the 21st century challenges in public health for the country. What I would do is that maybe around 50 minutes or so, take you through a journey of public health that this country has experienced and witnessed in last 70 years, but also looking at what is the current landscape of challenges that we are confronted with. And from the global perspective, how do we respond to these challenges where we can really position India as the world leader, not overall looking from the perspective of world power, but from a perspective of healthy India also. I'm not going to pulverize you with the PowerPoint presentation. On the other hand, I would like to communicate with you as directly as possible on the issue which I believe warrants much more public discourse in this country as it does today. And in that context, what I will do is that I have 3 slides to talk to you, which highlighted some of the issues which are critical when you look at the public health agenda for the country. Let me take you back in retrospect to 1947. We as a nation was independent in 1947. We were 360 million people. Our population was 360 million in 1947. The overall literacy rate was in India in 1947 was merely a 16%. I'm talking about 16%. And do you know what was the female literacy rate? It was 8.9%. So when we got independence, 1 out of 11 women was able to read and write. And on the health front for that matter, the life expectancy was merely 36 years. We had only 50,000 doctors and 725 primary health centers. We as a nation traveled a long way in last 71 years. And where do we stand today in 2017 or 2018 for that matter? If we look at the India story, we are one of the largest and vibrant democracy in the world with 1.35 billion people living in this country, likely to surpass China by 2034 or so. And from the demographic perspective, we are currently the number 2 in the world, and we would be one of the largest country in next few years or so. We are doing reasonably well on the economic front. Our finance minister tells us that we are based on sound fundamentals of the economy, and we are continuously sustained to grow with the rate of around 7 to 8% as economic growth. And that would certainly find a way for us in next couple of decades or so to position ourselves as a world economic power. If you look at the total world economy, the United States of America leads with 20.4 trillion US dollars economy, which is followed by 14 trillion US dollars economy in China, 5.1 trillion US dollars Japan, 4.2 trillion US dollars Germany. Then you have two European countries, UK and France, with 2.94 and 2.93 trillion US dollars respectively. On the 7th position, the India stands with 2.85 trillion US dollars. And then Canada, and then you have the Italy and Brazil and Canada with 2.18, 2.14, and 1.8 trillion US dollars. If you look at the world economy, it's 88 trillion US dollars in 2018. And that is expected to be double by 2050, when India will be the second largest economic power in the world. And our economic growth is consistently doing pretty well. So on that front, we are probably doing well. We are ranked, as long as the defense might is concerned, 4th globally. We are 5th in space in the world. We are number 2 in the internet use, with 493 million people in India use internet services. We have more than 1 billion cell phones in Indian hands. 88% Indian households have minimum 1 cell phone. Of course, that's a different story, that till recently 45% of the rural households had sanitary toilets. If you look at all news TV channels globally, India is number 1. So actually it tells us that India is doing pretty well on several fronts. But to me, all this together doesn't add to what I see India make as a world power. And there are reasons for that. Let's understand reasons first beyond health sector, and then come to a landscape of the health sector also. If you look at the poverty, a third world poor live in India. If there are 100 poor people in the world, out of which 35% or 37% poor people live in India. 32% of our own population is below the international poverty line. That's 1.2 US dollars spending per day is the cutoff that could be used. So on that front, we are not doing well. Huge inequity in the country. If you look at gender inequality index itself, it also tells us that 130 out of 155 is the position and rank that we have, just not acceptable. Brings about the insensitivities in the context of gender inequalities. I just mentioned that 4-5 years back, if you look at the rural households having access to the sanitary toilets, it was merely 45%. Thanks to the efforts of the current government, now it has gone up to 65%. But still, our targets are too far to reach to, as long as the sanitation is concerned. On the front of education, also we are not doing well. Although a literacy rate of 16% when we got independence, we have reached to close to 74%. But still a quarter of Indians are not able to read and write, even today. And when I give an example of 1 out of 11 women was not able to read and write in 1947, even today, every third woman in this country is not able to read and write. A recent survey which a couple of years back carried out in some hundreds, I think 260 districts in the country, have identified that 7-year-old children are not able to read letters, 50% of them. 20% of 10-year-old children are not able to read sentences, and 50% of 14 years old are not able to do a simple mathematic of divisions. Of course, we have some islands of excellence in higher education sitting on the sea of mediocrity. Not more than 10% of MBA graduates in this country are employable. If you look at the higher education in the parlance of expansion, excellence, equity, and employability. Expansion, it's happening because our population is growing. Excellence, we have troubles. Equity, there is a question mark. And employability are the challenges. So look at all these parameters which are beyond health sector. Doesn't convince us basically India could be a superpower with such kind of a situation, or a world power or a world leader in such kind of a situation. But also let's look at the health sector. Let's look at the landscape of public health in this country. I will begin with indices of a broader indices of development. Like for example, Human Development Index. Last year in 2018, we were ranked 130 out of 188 countries globally. But that's a broader Human Development Index which also incorporates beyond health indicators. But let's take about another index, SDG Health Index, that's Sustainable Goals Health Index. That is mostly related to the goal 3 indicators related to the health and well-being. There we stand 128 out of 188 countries. If you look at the Human Happiness Index, there we are ranked 133 out of 156 countries. If we accept these ranks and indicators, we are neither a healthy nor a happy country. And these are all broader indications, broader indices of conglomeration of several key indicators which actually defines the nation's characters. But beyond that, even you talk about specific to the health, do you know that we are the second lowest life expectancy in South Asia? Nepal and Sri Lanka and Bangladesh, they have better life expectancy as compared to India. And I tell you, 6-7 years back, India was in fact trailing Pakistan also. Now the worst life expectancy today is in Pakistan, but 7 years back, we were trailing Pakistan in life expectancy is concerned. Although we have progressed from 36 years to 68 years, but still we are the second lowest life expectancy in South Asia. Take another example of infant mortality rate. Our infant mortality rate is 38 per 1,000 live births. But what about 12 in Sri Lanka and 13 in Thailand? Several sub-Saharan African countries are performing better as compared to India as long as the infant mortality rate is concerned. Take another example of immunization for that matter. Our immunization coverage is around 65%. Even at the height of the civil conflict in Sri Lanka, their immunization coverage was more than 95%. Immunization coverage in Bangladesh and Botswana is better than immunization coverage in India. Several countries in sub-Saharan Africa have better immunization coverage as compared to India is concerned. And same is the story of nutrition. A third of our children, a total of 1/3 of our children are undernourished and underweight. So now the country which actually would like to take the advantage of the demographic dividend that would be available to us cannot have a third of their children being underweight and undernourished. India is otherwise amazingly young nation. The average age of Indian population is 28, 29 years. We would be 29 years in next year, 2020. When rest of the world is aging, Japan, the average age is 47 years, Europe 46 years, United States 40 years, China is pretty close to 40 years, and our average age is 29 years. 65% of our population is less than 35 years, 50% of our population is less than 25 years. But you really wanted to take the advantage of this young population. We need educated and healthy population. We can't be uneducated and unhealthy and to see that we can use and leverage the demographic dividend which is available to us. What Professor Amartya Sen tells us in this context is that with this uneducated and unhealthy population, India cannot dream to be a world leader, and which is the fact and reality in the context of demography from that perspective. Take an example of communicable diseases. I will take an example of tuberculosis. 2.8 million cases of tuberculosis every year. Until recently, we used to say that more than 1 million of them are missing. We're not able to track them. How do we control the disease when has been identified as one of the national priority in the form of communicable diseases? 27% of tuberculosis burden is in India. What about non-communicable diseases? 69 to 70 million cases of diabetes in India. 1 million premature deaths are attributed to the tobacco consumption. 1.6 million premature deaths, 49 million disability adjusted life years, and 9% of the total disease burden has been attributed to the air pollution. The average age of heart attack in India is 10 years earlier than what it happens in United States or Europe. 62% of our total mortality is attributed to the non-communicable diseases. So from the non-communicable diseases point of view also, we have a serious challenge. And if you look at the overall disease burden, there are estimates which tells us that what is the overall disease burden. 20% of the global disease burden is in India, overall disease burden. If you talk about some specific issues, like I mentioned, tuberculosis, it's 27% of global burden. If you take maternal mortality, it's 15% of maternal deaths happening in India. And our disease burden is 2 times higher as compared to China and Brazil, China and Sri Lanka, and 1/3 higher as compared to Brazil. So when you talk about our neighbors in Asia or our peers in BRICS, we have challenges in terms of the overall disease burden is concerned. Not only that these estimates and numbers are specific to key indicators and disease issues, but if you look at the inequalities within the country, we have serious challenges. Saying that our infant mortality rate is 38 per 1,000 live births, although it's very high as compared to 12 and 13 in Sri Lanka and Thailand. But if you see the percentage point difference between the infant mortality rate in rural areas and urban areas, it's more than 17 percentage points difference. The infant mortality rate in rural areas is 17 percentage points higher as compared to the urban areas. A girl child born in Chhattisgarh or Madhya Pradesh is likely to die, 5 times more likely to die in the first year of life as compared to a girl child born in Kerala. So in the lottery of life in India, it matters where you are born. If as a girl you are born in Kerala, you have 5 times higher probability of survival in the first year of life as compared to if you are born in Madhya Pradesh or Chhattisgarh. Average Dalit woman dies 14.5 years younger as compared to women in higher castes. The under 5 mortality in scheduled tribes population is 15 percentage points higher as compared to the national average. If you look at the immunization and as per the income quintiles, the lowest income quintile immunization coverage is merely 47%. And the highest quintile, you have immunization coverage of 88%. There could be several examples of inequalities, which tells us one district in Assam, we have infant mortality rate as 37, and adjacent district, you reverse the digits, it is 73. Mewat is a district in Haryana, 55 kilometers away from the national capital, where the power of this country sits, worst in all key health indicators. If you go to Mewat and see infant mortality or malnutrition or immunization, you pick up any random indicator and you would find that that's the worst indicator. It's not like the, in very far tribal areas or rural areas where, accessibility and all other issues. But it's 55 kilometers from the seat of the power. That's the situation if you look at from the inequalities are concerned. And from that perspective, we have to see how we are faring on that. Infrastructure, we have 20% of the disease burden. To deal with that 20% disease burden, we have only 8% of the global doctors. We have only 8% of the global nurses, and we only have 6% of the total beds. There are 100 beds globally, we only have 6 beds in India. So from the infrastructure point of view also, we are not doing fairly well. So some of this information is little negative and dismal, but it is important to see because our national bird is peacock and not ostrich. And if we wanted to identify problems, we have to look around to see what are those problems if we wanted to fix them. From that perspective, we need to understand from the health landscape relationship, India has several challenges comparison with several other countries globally. Now the question is that how these challenges can be and ought to be responded to. And in that perspective, we'll have to reflect on 2 important issues. One is that what influences the health of the people? And second important issue is that health service as the delivery vehicle. So let's reflect on 2 important issues of what influences the health of the people, and then to understand that how health systems strengthening and health system design overall is critical in improving the population health and public health. Sir Michael Marmot tells us about the social determinants of health, that the conditions in which we born, grow, live, work, and age have influence on our health. And you randomly pick any social determinant and you would find that had direct or indirect connectivity with the health. There are a few examples like income and poverty, and we had seen all them basically, education and water and overcrowding, sanitation, food, transport, air pollution, climate change, even health and social services. All these, most of these social determinants, they have direct impact on the health. And therefore, even you talk about sustainable development of health, and you would find that goal number 3 is directly related to the health, we also need to understand that even other indicators, like first 2 indicators, like related to the poverty and hunger, have huge influence on the goal 3 for that matter. So SDG 3 has very cross-cutting and cross-sectoral connections from the health perspective. And I'm happy that the theme for this particular conference has been chosen as the interdisciplinary approaches that are critical in advancing the health, clearly reflects the relevance and importance of how these transdisciplinary approaches are important. Because if we wanted to improve the health, we will have to deal with all these issues. Health cannot be improved by staying only within the health sector. If you say that I am the doctor or I am the nursing professional or I am a public health professional and I work only in the health sector, health of the population cannot be improved. For improving the health of the population, you have to go beyond health sectors and we have to engage with other sectors because all these parameters contribute to the health for that matter. I will give you examples like approaches beyond the health, like for example, how the policies in other sectors are important and relevant. At Stanford University, there's a professor Basu, who actually looked at, and he used Indian data, and therefore I'm presenting this example to you. He looked at how the policies in other sectors are critical in improving the population health. And he took the recommendations of World Bank and World Health Organization, which tells us that the smoke-free laws and appropriate taxation on tobacco products, these two key indicators can have a huge influence on reducing heart attacks and strokes anywhere in the globe. He used the Indian data and modeled that on all Indian parameters and came to a conclusion, and he tells us that if you can have the smoke-free laws being appropriately and adequately implemented, and the taxation of tobacco products is adequately taken care of, with these two interventions which are absolutely beyond the health sector, we would be able to reduce 25% of the heart attacks and strokes from 2013 to 2022, because he has done this work in 2012. So that's a period of actually 10 years that he looked at. We can reduce and we can actually take care of that 25% of the heart attacks and strokes. And you know the impact that would have? It would have much more impact than all cardiologists of this country would prescribe all kind of drugs in these 10 years. No, these interventions are beyond the health sector. Will have such a tremendous impact on improving the health of the people. Let's take another example of sugar-sweetened beverages. If we appropriately tax and bring a taxation policies for the sugar-sweetened beverages, and if you increase the taxation by around 20% tax, the 11.2 million people with overweight and obesity would be prevented, and almost 400,000 cases of diabetes would be prevented in a 10 years period, is another example. And of course, air pollution is another third example where I just mentioned about 1.6 million premature deaths because of air pollution in this country. 49 million disability adjusted life years could be attributed to the air pollution. And if you wanted to control air pollution, doctors hardly can do anything. Doctors or nurses or anybody, we are health professionals. Unless we engage with the other government sector and other departments and ministries to see and actually go and talk to them in terms of the economic burden of air pollution, the health burden of economic solution, the social burden of air pollution, and convince and move the governments to act against the air pollution so that it will have a reduced impact as it has today on the air, related to the conditions which are attributed to the air pollution. So all these challenges needs to be looked at from that perspective. Now let me tell you another example, and which is important to understand the relationship between the economic development and health. You'd find that several 20th century economists believe that the economic development will automatically carry health forward. And inevitably, health will benefit from this accelerated economic growth. And there are several examples to tell us that as the countries progress on the path of economic development and growth, the life expectancy and other indicators related to health have been shown to improve. This can also be well demonstrated with the Millennium Preston curve, where on one axis you plot the life expectancy of the countries, and on another axis you plot a per capita national income. And you would find a very strong relationship between the life expectancy increase with the increase in the per capita national income, till up to 4,000 to 5,000 US dollars per capita, and then it gets flattening off. But India, we have the national per capita income is between somewhere 1,700 to 1,750 US dollars. So that 4,000, 5,000 US dollars is a long way to go. So as the country would actually march on the path of economic development in next couple of decades, will have impact and influence on our health indicators, also on life expectancy also. But the Wilkinson and Prickett, they looked at this scenario from a different perspective. While they agree that yes, the economic development will contribute to the health development, and as the economic growth will be there, and this accelerated economic growth will contribute to improving our health. But they looked at the global data at different points to tell us that the inequalities within the countries do matter. They compared the countries with the similar per capita national income and correlated with the life expectancy, and they found that the countries where inequalities are on lower side as compared to the countries where greater inequalities, there they correlated strongly with the life expectancy. They said that if you have reduced inequalities within the country, the contribution of economic growth and development as life expectancy outcomes will be far better as compared to the countries where there are much inequalities. Unfortunately, we are a startling example of very visible, rampant, and significant inequalities within our country. I gave an examples to you. I gave an example of a girl child born in Chhattisgarh and Madhya Pradesh as compared to Kerala. And there are several. You take any random key health indicator and you would find there are inequalities from the perspective of that. So now that's the relationship between the economic development, because I'm talking about other sectors. Because this is important for improving health, we have to also see that what is happening in other sectors, because that have direct bearing on health. But what is the other way around of looking at it? Because economic development will happen, that is one thing. But how it happens and how we actually as health professionals, we should argue that if health improves and how it will contribute to increasing productivity and increasing the national income and national growth and economic development. So how health can also contribute. So it's not the one-sided story. From that perspective, it is also important to see that how investment in health is important, relevant, and critical even for the economic growth and economic development of a country. I will give an examples of 3 commissions. The first one is the World Bank. They had constituted a commission on investing in health in 1993. And one of the major and key recommendation was that investment in health is extremely critical in advancing economic development for any country. The another commission at the turn of the last century, that was the WHO Commission on Macroeconomics in Health, has explained to us bidirectional relationship. Based on the huge amount of data globally available, they tell us that economic development will continue to contribute to the growth, continue to contribute to the health, but if you invest more in health, then the health will improve. Because the health will improve, people will be more productive. Because people will be more productive, it will contribute to the economic growth, which will contribute to the economic development. So this bidirectional relationship has been highlighted through this the WHO work that was carried out. The third commission in 2013, Larry Simmers and Dean Jamieson co-chaired this Lancet Commission, which was published in few years back in 2013, has brought us very startling information. What it tells us about that, yes, agreed that the bidirectional relationship is there, but they actually talked about how investment in health is critical. And they estimated that if you invest $1 in health, you would get returns to the minimum of $9. In fact, they provided a range of $9 to $20 because they have model data from different countries. From low and middle income countries, the investment on return of $1 would give you up to $9 is the recommendation of the Lancet Commission. Now we will continue to debate and dialogue the process and methods that are being used for these estimations. We continue to dialogue that how strong evidence is this. But let us understand that in health, if suppose we are investing $1, we get $9 in return, any financial analyst in the world would give you that returns of, you say that I have $1 and I want $9. Anybody would give it to you? Nobody. No financial analyst would provide you in economic terms those kind of returns as one can invest in health and the kind of returns that one can get. So that's important to understand from these Lancet Commission's reports. There are many examples like this in low and middle income countries between 2001 to 2011, the 10 years period. 25% of the economic growth in these countries has been attributed to improved the nutrition, social and health policies. So you have better policies to invest in health, and that has been contributed to the economic growth in that particular decade. That's another example. Robert Fogel was an economist and a Nobel laureate, and he actually looked at in a retrospective fashion the data from 1790 to 1930 in Britain. And he said that during that 140 years, 50% of the economic growth in Britain was attributed to the improved nutrition, social and health policies where the investment has taken up, and that investment has actually contributed to the economic growth in Britain during that particular period. Non-communicable diseases and the premature deaths that are attributed to the non-communicable diseases. People die early because of non-communicable diseases, and at the mid-year energy is sapped because of the early and premature deaths because of the heart attacks and strokes and diabetes and others contributing to the conditions. Has been actually calculated in the period of 2011 to 2030, it's in the period of 20 years, it's 4.58 trillion US dollars loss because of non-communicable diseases. Now, because sometimes when you go to the policymakers and when we visit the ministry people and you talk to them in terms of the health burden, sometimes they may not relate and find it relevant. But when you talk to them in terms of the economic burden, if you go and tell them that, because of non-communicable diseases in 20 years, it's 4.58 trillion US dollars globally, of course, this is global figures, would be lost because of the premature deaths attributed to the non-communicable diseases, people start taking things seriously. And therefore, like air pollution or NCDs or in infectious diseases, it's important that we actually also calculate in economics terms what is required. Another example is the depression and anxiety. Globally contributes to 15 billion work days are lost every year. Every year, 15 billion work days are lost because of the anxiety and depression. Work days are lost. And that translates to close to 1.15 trillion US dollars economic loss in a particular year. It is also actually has been estimated that if you have an increase in 1 year as a life expectancy for a nation, that would actually contribute to 4% increase in national per capita income. So suppose our life expectancy is 68 years. We take it to the 69 years, or from 69 years to 70 years. That will actually enhance by the 4% overall national per capita income, which is attributed to the year increase in life expectancy, is important. And it will also have multipliers effect from the employment generation point of view. We need to understand that by training I'm an economist also, but the point I'm making here is that it's not the monetary value. It's not the instrumental value of the health which is important. And sometimes the debate is versus instrumental value about the intrinsic value of the health. But we need to realize that the intrinsic value of the health is critical because health is actually a right. It's our right. And from that perspective, we need to look at all these numbers, not from the perspective of its instrumental value, that health is an instrument of advancing economic growth or economic development. It should not be seen from that perspective. Having talked about this from the health system's perspective, but when I am making a point that there has to be investment in health, there are several reports globally, nationally available to tell us that we need to invest more in health. It is important for a country to invest more in health. But unfortunately, story is, not acceptable. If you look at the health expenditure as a percentage of GDP in this country, it is 3.8%. Suppose we earn 100 rupees as a nation, we spend 3 rupees 80 paise on our health. Our health expenditure is 3.8% of the total GDP, and that includes all Indians plus our government. It's public spending plus our out-of-pocket expenses together. Everyone in India, including government, spends 3.8% of our GDP on health. China spends 5.4%. Mexico spends 6.1%. United Kingdom spends 7.3%, 9% almost. Germany spends 11%. United States whooping 17%. We are not just there. We must see that how we invest more in health. And this is talking about the total percentage of GDP. But what about the spending by the government, the public spending? If you look at the public spending in India, it's ranging between 0.9 to 1.1% of the GDP in last 10 years or so. It has never crossed 1.1% of the GDP being spent by the government of India on the health of the people of this country, which is half of Sri Lanka, which is fourth of China, and which is sixth of Thailand. So the government of Thailand spends 6 times more as compared on the health of the people in Thailand as compared to what the government of India spends on our own health. And if you look at this percentage, basically, therefore, it's merely 30% of the total healthcare expenditure in the country which is taken care of by the government. So as long as our out-of-pocket expenses are concerned, that we as Indians, other than government, what we spend our pocket is almost 70% on our health. This is one of the highest in the world. These numbers are, we are ranked 152 out of 172 countries globally on the out-of-pocket expenses we Indians spending from our own pockets. And as long as the government spending is concerned, we are ranked at the bottom globally. So these are the challenges that we are facing in terms of the financing in health is concerned. And how it contributes then. Because we have to spend 70% of our health expenditure. That too, it is less. 3.8% is just less. But even of that 70% that we have to spend, and the problem is this, that it is pushing because of the unaffordable health care. Every year, 4% of our population is pushed into the poverty. Estimates, different economists had calculated different estimates, ranging from 50 million to 83 million. There are some estimates 50, then 60, 63, 83. But even if you take lowest, actually conservative estimates of 50 million, so every year 50 million people are pushed into the poverty, which is certainly not acceptable. Of course, there is a commitment in 2017 National Health Policy that we wanted to raise this to the 2.5% of the GDP as the spending on health is concerned from the government in this country. And we look forward to that to happen. And I tell you another example, like out of the total money that we spend, 70% is on outdoor expenses. Only 30% is on indoor expenses. And out of those outdoor expenses, 70% is on the drugs. Even if the government of India commits to provide 0.5% of GDP as a budgetary provision, we would be able to provide free drugs to all Indians. That's 0.5% of the GDP. So the health financing, investment in health is concerned, this is what is the story as a systems point of view. Dr. Tedros, who has been appointed Director General World Health Organization recently, what he tells is that this is an outrage. Of course, he's talking about the global context. No one should have to choose between the death and financial hardships, but the shocking truth is that this is a reality for millions of people every year. This is not something different in India. He also tells us that 100 million people globally are pushed into extreme poverty every year. And if you actually translate that to in the context of the time, in every second, there are 3 people who are pushed into the extreme poverty every second because of unaffordable health care. That remains a challenge. But financing is one thing. If you look at health systems perspective, we have 6 building blocks. Health financing is one of them. We have health information systems, we have health service delivery, we have health workforce, then this medical products, drugs and devices, and finally leadership and governance. These are the 6 building blocks when you talk about health systems. One of the block is human resources for health. Looking at the health workforce in our country, we have 5 million people working in health workforce in this country, out of which 3.8 million are trained professional health professionals, which includes, like, for example, doctors, nurses, pharmacists, public health professionals, our ANMs, everybody. And you have 1.2 million people who are the support staff, like, administrative staff or ambulance drivers or sweepers who are working in the health sector for that matter. So we have this 3.8 million and 1.2 million translates to actually 5 million people. And there are, in China, it's 10 million people as a health workforce is concerned. If you look at from the perspective of the doctor to population ratio, we have 1 doctor to 1,429 people. Recommended is 1 for 1,000 population. So we are not there. If you look at nurses to allopathic doctor ratio, we have 1:1.7. And if you include all doctors, including Ayurveda and other practices also for that matter, it is 1:1. And what is recommended globally that it should be 1:3. OECD recommendation is it's 1:2.8. So there's to 1 doctor and you need 3 nursing professionals. So we actually need much more nursing professionals also. There also is a challenge that we are confronted with. If you look at the health workforce density, it is calculated 20.7 per 10,000 population. And this 20.7 includes only, I'm talking about the doctors, they say that skilled health workforce, doctors, nurses and midwives. Only doctor, nurses and midwife total, it's 20.7 per 10,000 population is the health workforce density in India. What is the minimum threshold that has been recommended by World Health Organization for comparison between the countries is 22.8 per 10,000 population. That's the minimum threshold. The intermediate threshold is 34.5 per 10,000 population. And the optimal, what has been recommended is 59.4 per 10,000 population is recommended. Of course, that's too far to go. But even we are not there close to that minimum threshold that has been required as long as the human resources in the country is concerned. These are the challenges. Take an example of medical specialists in this country. You talk to the Foxy people. They tell us that we are a shortage of 40%, by 40% the obstetricians in this country. You talk to IAP, they estimated they need 2 times the pediatricians that we have in the country. So it's 50% deficit of the pediatricians. You talk to the psychiatrists, they would tell that we are not just there. And one of the recommendations of the World Health Organization in terms of the psychiatrists that we need in the country is huge deficit. With the current, our supply side, we cannot achieve that in next 50 years also. So these are the challenges from the human resources point of view. Our supply side, we have increased tremendously in last few years, the medical colleges, nursing schools, pharmacy, public health schools. We have tried to increase that in last few years. And now we are actually producing 7.5, the intake capacity, 7.5 lakhs is the intake capacity that is available in all the courses and all the institutions in this country. But the question also is not expansion. The question also relates to the excellence and quality. The kind of product that we are producing is really suitable to work in the systems also remains a challenge, but I'm just talking about even numbers is a challenge. We have 72% of our health workforce in private sector. And therefore, for our government programs, it is very critical to see that how do we leverage the private sector resources that are available so that we are able to provide better and affordable healthcare to the population. That also remains critical. So 3 messages emerge what I told to you. One is that if you look at the health landscape of this country, we are not doing terribly well as long as very key indicators are concerned. Number 2 is that if we really wanted to improve on health, we will really have to engage with other sectors, and therefore approaches beyond the health sectors are also important. And third is we will also have to strengthen the health systems. And therefore, Dr. Tedros again tells us that this UHC-based approach for the strong health systems remains critical. We need a strong health systems where I talked to you about the building blocks. health workforce, self-financing are critical. What we see is therefore, from the perspective of within health sector, universal health coverage remains an important milestone, and I will not deliberate in much more detail because we have a session on that following on universal health coverage. But it tells us all about three parameters. One is that all of the people, that it talks about if we are able to provide affordable health care to the all population. Second is that if we are able to do it in a quality health services being provided. Of course, it includes both public and private sector. And it also talks about providing the financial protection is concerned. And it has been actually a global agenda also. It's not in India for that matter. You have two world leaders telling us like universal health coverage is the most powerful concept that public health has to offer. And President of World Bank, Jim Kim, tells us that we must be the generation to deliver universal health coverage, otherwise our next generation will blame us. Dr. Tedros tells us that the universal health coverage is based on the conviction that the health is a human right and not a privilege. It's a question of right, it's not a question of privilege. And therefore, he also actually continues to tell us that it takes unwavering political commitment because it's a political choice for that matter. It has to be a governments will have to make the political choice. And now we don't have any options but to provide people the health care that is affordable to them through a quality health services. But universal health coverage is an approach towards dealing with the diseased people, maybe a primary level of prevention that you talk about, primary health care. But the question also remains that this financial protection, which is important to the universal health coverage that we would be providing, but functioning health system will also be there. I will take few minutes, just a minute. We will have to see that this financial protection plus this the functioning health system, we will also have to see that the social determinants are addressed. And therefore, if we really wanted to assure the health of the people, if we wanted to assure that we wanted to give an assurance about the health to the people, universal health coverage is an approach to provide affordable quality health care that is necessity. But it is not sufficient to actually take care of our health scenario because we will also have to engage with the social determinants which contributes to the health. And therefore, health assurance has two parts. One is that we need to provide universal health coverage, plus you also deal with the social determinants, and that will actually assure health to the people of this country. Because health assurance has two words. One is assurance and health. It is assurance to the people of this country about their health, the health they dream, desire, deserve, and demand, because we are in a democratic society. So if you look at from that perspective, then the government of India thinks that Ayushman Bharat, which has two important components. One is that strengthening primary healthcare system, that health and wellness centers being thought as the nucleus and centers of providing care to the rural population, where it has been actually planned to have 1.50 lakhs of these such kind of centers, because currently our sub-centers can only provide, as we all understand, maternal and child health and some extent of infectious diseases, but to incorporate more infectious diseases plus non-communicable diseases, making drugs and diagnostic facilities available, to going step further forward is one of the intent about the health and wellness center where you can strengthen the primary health care. And second important is the National Health Protection Scheme and mission that has been also talked today afternoon, so I will not deliberate, but the whole idea is that to provide the insurance cover up to 5 lakhs to around 10 crores of the family in this country, which would about 40% of the population might be covered, and the center and state contribution would be 60 to 40%, which actually is directed to the providing secondary and tertiary care. But the challenge there I would like to say in last couple of minutes is on impact of these insurance schemes. Unfortunately, if you look at the impact of insurance schemes in this country has not been very well. And I will explain to you, like the hospitalization rate in this country is 4.4%. You take random 100 people and you will find 4.4% are actually admitted to the hospital minimum once in a year. And any scheme or any state in the country so far, because last 10 years we had seen several schemes, not covered more than 1% population. RSBY is one of the scheme which is talked about at very high rate, has covered only 5 to 6 per 1,000 population. Maybe there are challenges in the context of enrollment and utilization, And we need to see that our out-of-pocket expenses are close to 70%, or 68% are the out-of-pocket expenses that we have. And if you have, you know how much money that we as Indians spend on our health per month? It is 200 rupees, out of which 130 are on indoor health, outdoor health, and only 70 rupees are on indoor. Now, this National Health Protection Schemes actually talks about the insurance for the hospitalization purposes. So that will only target that 30% of our out-of-pocket expenses. So despite that this scheme is, in full pledge available with full rigor and vigor, it will not have significant impact on our out-of-pocket expenses. And therefore, while we continue to discuss and dialogue about the efficiency and equity and economic prudence of this new scheme, we will also have to see the implementation and impact of this overall scheme in next few years to come, so that we can say that it really contributes. So for health assurance, the time has come to shape the slogan that we will have to look at from the perspective of the universal health coverage, plus addressing the social determinants beyond the health sector and engaging with the policies. That would provide us an opportunity to respond to the aspirations of the people of this country to be a world power from the health perspective is concerned. And therefore, we have to advance the overall agenda for that matter of health assurance for moving towards sustainable development goals, although it's in the sustainable development number 3, but it's a cross-cutting, and therefore I'm also like to mention at the end that I'm happy that the theme that has been identified about interdisciplinary, but sometimes, it's a jugglery of words, but it's important that we're moving from interdisciplinary to multidisciplinary and from multidisciplinary to transdisciplinary for that matter. So I would say that linear relationship and movement should be reflected, and I'm sure that the deliberations that would happen in the next 2 days would contribute to enhancing the knowledge for all of us, and how do we actually take the country on the path of transdisciplinary approaches that we have. And that will help us to create a Swastha Bharat along with the Swachh Bharat. Thank you so much. Thank you, and if you have any questions, I don't know, so any questions, would be happy to respond.
Thank you, sir, for a very, very enlightening talk. Really congratulate you on your retaining power of so much statistics. We are really, really overwhelmed. Wonderful. I just want to make a comment here that you've been talking about so many of these building blocks. And I was just wondering, in our country, our culture of celebration always involves a lot of eating. And it's a very simple thing to do, starting from the school level to the family level, that we start imbibing and telling our children when they are young to change their habits in alignment with good health, as to change our culture to a healthier culture. What are your thoughts on that?
I fully agree, actually. I had picked up that example, also dropped it because of limitation of the time. But all these parameters, like for example, eating habits, like junk food for that matter now, and the impact of the junk food, and looking at sugar-sweetened beverages was one of the examples, but you look at the processed foods that are available in the market, the impact of that on the health, that the salt content and sugar content, and then the impact on health, huge impact. So overall nutrition contribution to the health is again one of the very critical and important transdisciplinary approach probably one needs to act. I fully agree that these are several interventions probably would be required to be healthy.
Hello, sir. As you mentioned RSBY, and I'm from Rajasthan, there RSBY has done very good. So I want to ask you about the scheme Ayushman Bharat, and what you think it will be beneficial for public health.
Yeah, it's like I just mentioned, actually, Ayushman Bharat is a very ambitious program. It's fully government. It is one of the largest government-funded program globally. I will not get into the debate of labels, whether we should call it an insurance program or not, because it's basically the taxpayers' money. It's the government is funding. It's in 60-40% central and state government. So the money is coming from the taxes basically, and so it's not that the insurance that anybody would be paying, covering 10 crores, 10.4 crores of the families, and up to 40% of Indian population particularly on the lower side, and it will have the 5 lakhs of coverage. There are 3 issues related to that. The implementation and impact of this scheme will need to be assessed from these perspectives. One is that the kind of the package, the kind of services that we would like to package, and there are deliberations going on basically that how do we, create that package. Number is that empanelment of the providers, private sector and public sector both. And third is the treatment protocols, management guidelines. So these are the 3 critical elements that if we would be able to serve on that, that will have better impact. But it had just begun, we will have to see, but it is the right step towards providing the secondary and tertiary care to the population because of the huge morbidity associated and mortality associated. But my only concern is that, because that will address only secondary and tertiary care, and the component of that is only 30% in India. If you look at our out-of-pocket expenses, we spend 200 rupees per month on health, out of which we only spend 70 rupees on hospitalization. So it will address those 70 rupees. It will not address those 130 rupees. So the reduction the impact it will have on the reduction of out-of-pocket expenses, where we are talking about unaffordable healthcare and pushing people into the poverty, will have to be seen in near future. But the commitment is in there, and thinking is in the right direction. Okay, thank you. Thank you so much. Such a pleasure to be here. Thank you so much.
Thank you, sir, for a wonderful and highly knowledgeable session. I request Dr. Samita Jadhav, Deputy Director, Symbiosis Institute of Health Sciences, to felicitate our speaker.